Sample of fecal material, solid body waste, that's collected in a special container when infection, bleeding, or parasites in the colon are suspected. Sometimes a warm specimen is ordered. This means that the specimen must be tested in the laboratory while the specimen is still warm from the patient's body. You will be told whether the specimen that you are to obtain needs to be done so with it warm. The stool cannot be mixed with urine, so be careful to keep them separate. Now watch a demonstration of collecting a stool specimen. Collect your supplies. Identify the patient. Check the identification bracelet against the requisition slip. Explain the procedure. Wash your hands and put on your gloves. Offer the bedpan or assist to the commode or bathroom. Ask the patient not to urinate into the bedpan and not to place tissue in the bedpan. Provide instead a plastic bag to dispose of the tissue. When finished, remove the stool collection to the bathroom. Remove a sample of stool from one area. Place it in the container. Obtain another sample from a different part of the stool and place in the container. Cover the container immediately. Observe the stool for any abnormalities. Notify the nurse to observe if needed. Place the correct label on the container and place both in the biohazard bag. Be careful not to touch the inside of the container or lid to avoid contamination. Then empty the remaining stool into the toilet and flush. Complete the steps as with a routine urine collection demonstration. When internal bleeding is suspected, stool is checked for the presence of blood. Ulcers, cancer, and hemorrhoids are common causes of blood in the stool. Often blood is visible. Stools can be black or tarry if there's bleeding in the stomach or intestines. Sometimes bleeding occurs in very small amounts. It's difficult to detect such bleeding if you're just observing the stool. Therefore, stools are often tested for the presence of what's called occult blood. Occult means hidden or unseen. Many factors can affect the test results. Patients are instructed to avoid aspirin or any other non-steroidal anti-inflammatory drug for 7 days prior to the test. They also are to avoid vitamin C for up to 72 hours prior to the test. There can be some other restrictions as well. Be sure to refer any questions about the instructions to the nurse. Now I'd like you to watch a demonstration of testing a stool specimen for blood. Collect your supplies. Identify the patient and check the identification against the lab requisition. Explain the procedure. Wash your hands and apply your gloves. Offer the bedpan or assist to a commode or bathroom. When finished, remove the stool collection to the bathroom. Open the test kit. Use a tongue blade to apply a thin smear of stool to box A on the test paper. Use the other end of the tongue blade to obtain a smear of stool from another part of the specimen and apply to box B on the test paper. Close the test packet. Turn the test packet to the other side and open the flap. Apply developer to boxes A and B according to manufacturer's instructions. Wait the amount of time specified in the instructions. The time can vary from 10 to 60 seconds. Note and record the color changes. Follow the manufacturer's instructions. Immediately show any abnormal test results to the nurse. Dispose of the test packet and tongue blade in the biohazard bag. Empty the remaining stool into the toilet. If your facility has a laboratory that performs this test, send the sample to the laboratory without opening up the back flap. Attach the requisition and send it to the lab. Finally, complete the steps as was demonstrated with the routine urine collection.